Have you ever felt a persistent, dull ache in your upper abdomen, perhaps spreading towards your back, and wondered what might be causing it? Many different issues can cause these kinds of symptoms. When these concerns arise, especially if they are new or worsening, your mind might naturally turn to internal organs, including your pancreas. When doctors need to investigate potential pancreas problems, they embark on a systematic process. They begin with a thorough discussion about your symptoms and your overall medical history. This initial conversation is crucial. Following that, they perform a physical examination and often order a series of specialized blood tests. If the initial findings suggest a pancreas issue, they will usually recommend advanced imaging techniques to get a clearer picture. Pinpointing a pancreas problem can be quite complex because the pancreas is nestled deep within your abdomen, behind your stomach and other organs. This deep location makes it difficult to assess through just a physical touch. Moreover, many pancreatic symptoms can mimic those of less serious conditions affecting the stomach, gallbladder, or even the back. Therefore, doctors relying on various tests to look for specific clues. Blood tests are often the first step, checking for elevated levels of digestive enzymes like amylase and lipase. These enzymes can indicate inflammation, a hallmark of conditions such as pancreatitis. Sometimes, doctors also look at tumor markers, like CA199, although it is important to remember that such markers are not definitive diagnostic tools on their own. To gain visual insight, doctors employ several imaging techniques. An abdominal ultrasound might be a preliminary step, offering a non-invasive view. For more detailed images, a CT scan, which stands for computed tomography scan, or an MRI, a magnetic resonance imaging scan, can provide cross-sectional views of the pancreas and surrounding structures. An MRI is especially useful for visualizing pancreatic ducts. When an even closer look is needed, or if a biopsy is being considered, an EUS or endoscopic ultrasound might be performed. This procedure involves a thin, flexible tube with an ultrasound probe on the end, guided down the throat to the area near the pancreas. Finally, an ERCP, or endoscopic retrograde cholangiopancreatography, can examine and sometimes treat problems in the bile and pancreatic ducts. It is fascinating how the CA199 blood test, while often associated with pancreas health, is not specific enough to diagnose pancreatic cancer alone. Its primary utility is actually in monitoring treatment effectiveness or disease recurrence. Another insightful detail is the multidisciplinary team approach. For complex pancreatic conditions, specialists from different fields, such as gastroenterologists, oncologists, and surgeons, often collaborate. They review all test results together to ensure the most comprehensive and accurate diagnostic conclusion. This teamwork is truly a cornerstone of modern pancreatic care. Understanding the various tests doctors use to assess pancreas problems empowers you as a patient. By knowing what to expect and why certain procedures are performed, you can engage more effectively with your healthcare team. This proactive partnership is invaluable, ultimately leading to a more accurate diagnosis and a well-informed path to managing your pancreatic health.